Well, hi everyone. Welcome to the National Spine Health Foundation Facebook Live. We're so glad that you're here today. My name is Erica Anderson, and I'm here today talking with our CEO, Dr. Rita Roy. Thank you, Rita, for chatting with us today.
Yes, thank you for inviting me on. It's certainly an unusual time. I'm happy to be back on Facebook again to share with our audience all the things that we're doing and to talk about this idea of Giving Tuesday. So thank you for carving time out for me.
Yeah, we're hopping on a little late. If anyone is joining us live, we had a tech issue, but luckily not too late. But yeah, so really interesting thing happening. Normally Giving Tuesday is like towards the end of November. It's more in the Christmas season, but given what's been happening with COVID-19 and just everyone's struggling. The economy has taken a hit, and individuals, businesses, nonprofits, everyone is struggling. But Giving Tuesday, I think as an organization, they've decided, you know what, this would be a perfect time to give people that can give the opportunity to support those places that they really love and want to see thrive. So tell us, why are we, the Spine Health Foundation, participating in Giving Tuesday, which, by the way, is tomorrow for those that are watching?
Yeah, well, the Giving Tuesday Now campaign came across my desk, and and we looked at it and we said, "Wow, this global initiative to raise awareness about philanthropy and the idea of all the organizations that do so much good for so many people are still doing their work even during the pandemic." And it made sense to us to join into that cause. And we've got a pop up on our website, and if you come to spinehealth.org, you'll see our message there that says neck and back pain don't go away. COVID is here. COVID is here to stay. But neck and back pain are still here. And sadly, during the pandemic, we are seeing cases of neck and back pain that are getting worse during the stay at home and the isolation. So many of our supporters and our followers have seen the information that we've put out on how to take care of your back while you're working from home or staying at home. And we're worried and we're concerned about the people who we advocate for. And so, there's really never been a more important time for the Spine Health Foundation to exist and for us to share information on prevention and treatment of neck and back issues. We talk a lot about the fact that, the numbers, the statistics from the NIH and the census and the CDC show us that 100 million people are impacted or are faced with debilitating neck and back pain every year. That's a third of America. And so you say to yourself, okay, neck and back pain, maybe it's not that bad of a problem. Well, it is a bad problem. And if you've ever experienced it, or you have a loved one or a friend who has experienced the devastation that comes from being disabled from the pain is a symptom of a condition that's going on in your spine. You know that it's devastating. And so we're here to educate people about what you can do. One of the things that I love the most about Giving Tuesday is this concept of celebrating generosity in humankind. And we know that in times of economic downturn, we all have reserves of generosity that can be given. We see that happening all over our country, right? We see those stories in the news. People donating masks and food and supplies and things, and that just speaks to our human nature. And Giving Tuesday really celebrates that. How does that affect us at the Spine Health Foundation? Well, there are lots of ways that you can get involved in being generous with our organization beyond just charitable donations. Of course, we do have a $1,000 matching donation drive going on Facebook right now, $5,000 on our website that's got a matched donation on it. And we'd love to see that happen because that helps us continue doing the important work that we do. But there are other ways to be generous. Acts of kindness, sharing our information, being an ambassador for the work that we do, like us on social networks, share our information, give it to your friends and family. If you are part of a human resources department at your company, or even if you're not part of the human resources department, you are a human resource, share the tips and tricks that can help people working at home to take care of their backs. These are incredible resources. Many of them are simple tips and tricks that work, that help. And that is an act of kindness and an act of generosity that helps us get our message out, helps us do the work that we want to do in educating America. And so, we think about all the ways that people can be kind and people can be generous. One of the things that I've read about is the notion, the studies that acts of generosity are a way that we can overcome anxiety and depression. And one of the things we talk about at the Spine Health Foundation is that if you do have a neck or back problem, one of the things that comes along with that is a feeling of being isolated. So you layer onto that a pandemic and a stay-home order, and that just makes those symptoms worse. But an act of kindness or an act of generosity is something that you can do tangibly to make yourself feel better. And the studies all indicate that. So I do love that aspect of this concept of a Giving Tuesday.
Yeah, I mean, I think you make a great point in that Giving Tuesday, yes, essentially is about fundraising, but that is not the only thing that someone can do if they want to participate. And also just a reminder to people that, I think people often think about fundraising as like these massive amounts of money, but, even $5 goes a long way. And so, so we encourage people, if you can't give money, just share the page, let someone know what's going on, like that this is an available resource. Now, the other thing that we're doing that we wanted to kind of touch on is our virtual race is coming up. Sort of, kind of goes together with the Giving Tuesday theme. But this is something we didn't plan on. We were going to do the real thing in person, but because of the pandemic, we've had to shift gears as everyone has. So tell us a little about the race and what people can look for in that.
Yeah, thanks, Erica. I was going to mention that, sort of coupled with these ideas of acts of kindness and acts of generosity that we can do while we are staying apart from each other. One of the things that comes to mind for nonprofits like the Spine Health Foundation is the idea of community and connection, right? We are building a community. We celebrate our spinal champions. We tell their stories on our website and in our podcast, and we want to hear those stories. Spinal champion is a person who's overcome a neck or back challenge through a treatment, whether it be operative, non-operative. And, so we are all about community and connection. Well, that's hard to do when we are physically separated from each other, when we are socially distancing from each other. So we are doing our annual race. This is the 13th year that we've done a race. Lucky 13. We are doing a virtual race. And, again, this is a way that we can create connection even though we're apart. And so we're really, really excited to have partnered with Virtual Strides. And you can go to we'vegotyourbackrace.org and learn all about it. You can also just go to spinehealth.org and learn all about our virtual race. And the virtual race is a fundraiser, but it's also a health raiser. We are encouraging people to think about using the virtual race as a motivator to get healthy or to maintain your healthy habits or to encourage somebody in your friend group or your family members to join you. And it's sort of like a 1 month challenge. So you have a month to set a goal of doing a 5K, 10K, or half marathon. You could do it in one day. You could do it over 3 or 4 weekends. You could do it over the course of a week or 4 weeks. But the idea is just to do it. We've been putting out a lot of educational concepts about movement, right? So we're stuck at home. We've got to keep moving, whether that means, going up and down your stairs at home or in your apartment building or taking a lap around your block at home or taking a long walk. Got to keep moving. Movement is one of the single most important things you can do to take care of your back. And so the virtual race gives us an opportunity to share that mission in a tangible way, gives people an opportunity to be generous back to the foundation. It's a $30 registration fee that results in a donation to us. And join us, be part of our community, connect with us, connect with your family and friends, come join us. So we're really excited about putting that out there. There is a financial commitment to that, but again, this time of Giving Tuesday is really a time about thinking about how we are all connected, and we are all connected through generosity and through kindness and through giving back to the organizations and to the causes that mean the most to us. And we know that at the Spine Health Foundation, we get lots of feedback from users who say, thank you for what you're doing. Your information really mattered to me. I was able to find the right doctor and ask the right questions. And so we know that that our work matters to people.
And I was just going to say, don't forget, you do get a medal if you run the race. And I think it's really cool that there's the 3 options. So all levels of runners or walkers can participate in the race. And I think that it's just a fun, motivating thing to do for the spring. And to do it in the name of something that you really believe in makes it so much more powerful. So I think that's great. And I interrupted you. What were you about to say?
Yeah, no, I love to talk about the Spine Health Foundation. I love talking about what we do. I'm very, very proud to be part of this team. We are an incredible team that is really, really dedicated to the mission, and I get to be the spokesperson for it, which is a really awesome place to be right now. And even though we've been working from home for a long time now, we are still very connected to each other through our work. And one of the things that we've done is we used our voice as the patient advocacy voice in spine health to ask our elected leaders, the governor of the state of Virginia, where we are located, elected representatives. We reached out to members of Congress to say, once hospitals were in a steady state in many parts of the country, they had put into place their ability to manage and treat COVID patients. They had the capacity to be able to take on other surgeries that were called elective surgeries. But we put out information to say, not all surgeries are elective. And a one-size-fits-all description of what elective means is really not fair to patients who are suffering. So there came a time once we got the COVID patients, under control in some parts of the country, there was the ability for surgeons to be able to treat patients through necessary surgical interventions to help prevent spinal cord injury from their spine challenges. We do a lot of education where we say, don't wait until it's too late. You can suffer irreversible nerve damage. You can develop paralysis, incontinence, permanent disability if you don't get some of these conditions treated in a timely way. Well, the opposite message went out during the pandemic where we said, you know what? Wait until it's really a severe emergency, and then maybe we can get you into the operating room. That's not the message that we wanted to send. So we were able to use our collective voice as the voice of patients in spine health to say, when the time is right, when the PPE supplies have reached, a level that is usable, when the hospitals are capable and have their COVID patients, under good management and isolated, where other patients could come in and be treated for their conditions. So we say again on our website, back and neck issues do not go away when COVID is here. And in some cases, it is made worse. So, every dollar helps us to take these actions, to advocate for patients, to create educational materials. And we think it's really important. And we hear back from people that they think it's important too. So our virtual race is a fundraiser. It's also fun. It's not a huge dollar commitment, and you do get that really cool 3D medal, which will be mailed to you once you complete your challenge. And you get a digital bib, and you get to be part of our community, and you get to feel good while doing good.
All right. Well, thank you so much for filling us in on what's been going on. I know it's been a while since we got an update from you, Rita. So we appreciate that, and we hope everyone will go to spinehealth.org. You can find out all the information for Giving Tuesday, for the virtual race. And actually, you can also see the letter that we sent to the governor of Virginia about those, quote, elective procedures during COVID-19. And you can see some of the ways that we are advocating on behalf of patients in that very important way. And so anything before we sign off? You wanted to add anything?
No, it just in closing, it has been a time where we've been required to be socially distanced and apart from each other. But at the Spine Health Foundation, we are looking for ways to connect and to create community, even though we are apart. So I invite you to please join us, come be part of our community, and take a look at spinehealth.org.
Yeah, we'd love to have you guys. Thanks so much for tuning in, and we'll see you next time on Facebook Live.